Welcome to this GINA program. Today I will be discussing some of the challenges and achievements of the Public Health Ministry over the last year. With me is Minister within the Public Health Ministry, Dr. Karen Cummings. Welcome, Minister. Okay, Minister, it's been approximately 1 year since you have been attached to this ministry. Could you tell our viewers what the process was like for you, the experience over the year?
Thank you very much, Shivani, for having me on your program. It's indeed a delight, and I'm honored and at the same time humbled to give a reflection of the first year of the Ministry of Public Health, its achievements, challenges, and projections for the year 2015-2016. The first year of managing the Ministry of Public Health has been positive, even among the many challenges that exist. Our new government is determined and committed to significantly improving the quality of healthcare services delivered to Guyanese. The APNU+AFC government would have committed 28 billion Guyana dollars, an equivalent of 10.9% of the national budget, toward the development of the health sector. The delivery of primary health care remains our fundamental strategic approach by this government in realizing the health agenda, as seen as our overarching approach to healthcare provision in Guyana.
Okay, Minister. Over the years, I know taking over from another government may have been some challenges for you. Could you point out to our viewers what were some of your major challenges?
Well, first of all, if I can give an outline of the Ministry of Health, some of the key areas. We have our regional health services, we have our Department of chronic diseases, and we have chronic diseases are non-communicable diseases as well as the communicable diseases. Then we have the Family Health Department, and then we have which takes in the Food Policy Division, Environmental Health, and so on. So if I'm going to start with the regional health services, which is one of our key and most important departments within the Ministry of Public Health, because it delivers attempts to deliver adequate and appropriate care to all our citizens across the length and breadth of Guyana, which I mean the 10 administrative regions. Our achievements would be, we have had up to date 1,729 patients being seen by our doctors, especially in regions 1, 7, 8, and 9. Those are the hinterland regions. We have seen 130 patients that would have had successful surgeries at Mabaruma, Letem, and Bartica hospitals. Surprisingly, you would have known by now there are 3 towns. We've also had in Letem 72 successful surgical interventions. That's in Letem alone. We have deployed approximately 19 doctors to those regions, regions 1, 7, 8, and 9. Additionally, we've had doctors going to areas that there weren't any doctors before, like Isano, Mbaimadai. Those we have doctors there are waiting to go to be deployed there. We do have health centers and a few health posts. As you would recall, we have 5 levels of health care delivery, from the health posts to the health centers to the district hospitals to the regional, and then to the referral hospital. And so we'll continue our supervisory visits both at the coastland and the hinterland. Going back to the hinterland, we also have medical evacuation services. Even though we would have treat patients and so forth, but there are some surgeries that we have to either send in a team or we have to evacuate in cases of emergencies. Even though it's a lot of cost to the taxpayers and to our budget, but we have to do it if we want to save lives. But I guess in the near future, we're planning to send more specialists to those areas. So basically, our challenges would be in terms of procurement. So I guess that's going to be a common thread running through all the departments. We have inherited a situation or a system where we had sole sourcing, and so we're definitely going towards competitive bidding, and so we must have the teething problems as we switch or change the paradigm shift from sole sourcing to open tendering. And so you'll find that our CRIVs, we will call it, the combined requisition and issue vouchers, that the pharmacists or pharmacy assistants in those areas would have written depending on their consumption report before. And so you will say, okay, I've sent in my consumption report, and you hope another 3 months, within that 3 months you have your drugs. But there's always some delays. So there's a lot of delays which we plan to work on. And of course, inadequacies of human resources as well. And as I mentioned before, the shortage of specialists and inadequate transportation in some cases. In terms of regional services, we definitely want to have more medical doctors and more specialists. We want to continue to have, maintenance drugs, and we are very happy that right now we are working with USAID in working on procurement of drugs, and so we hope that in not too long distant future we'll be able to improve in that area. Our next big area is the non-communicable disease, or we call it chronic diseases. 70% of our budget takes in the non-communicable diseases, which even takes in mental health as well. And so we have had our integrated prevention and control of non-communicable diseases in the Guyana Strategic Plan 2013 to 2020. And so what we'll be rolling out basically are recommendations of that plan. And so there are 4 or 5, I should say, key areas as we consider that plan. And so the first area is risk factor reduction and health promotion. We want to look at integrated disease management and patient self-management as well. Education. We want to look at surveillance, monitoring and evaluation. We want to look at the national level public policy, our advocacy strategies, our communication, how we, setting up our communication unit, and basically program management. If I'm going to take them separately, for instance, our risk factor reduction, there are certain diseases there, and a lot of cancers, and so we definitely want to, prevention is our first route. Of course, we have state-of-the-art equipment at the Georgian hospitals to treat and to cure and even to give palliative surgery and palliative treatment. But our main focus, no wonder we've changed from Ministry of Health and Ministry of Public Health, because it's more public, and we want to have ensure that we have healthy people and healthy communities. So we definitely want to go through the preventative aspect. And so at our health centers, we'll be doing a lot of screening for blood sugar, screening for hypertension, doing lipid profiles. We want to do pap tests, pap smears, visual inspection of acetic acid, and so on. So we're very, very much big in our screening, and trying to, identify risks, as we treat patients. Health promotion is a big one, because we want to ensure we have to keep educating our patients, because, behavioral change is a process, and we have to keep working on that through our social media, our media campaigns, TV stations, infomercials, and so forth. We even use Mirandai. We have contracted to incorporate stories highlighting the issues of living with a chronic illness and how we can measures of prevention. We also want to work with the workplaces, where we're going to do screening as well. Health goals will be towards ensuring they have right BMI, the body mass index. We're also going to work with the school-based intervention programs, health talks. We want to have health clubs in schools, okay, and other awareness like diabetic retinopathy awareness, gestational diabetes for pregnant mothers who would have become diabetic during pregnancy, So those are, we make sure we are aware of that. In terms of our integrated disease management and patient self-management, we have 6 pilot areas in Guyana: Leg 1 Hospital, Wakenham Hospital, and Moore Polyclinic, Campbellville, Horstelling, and the East Bank Diamond Hospital, which we know very well. We should have had our passport, which includes treatment goals, which the patient would have. And we give them materials so they can follow the goals of their treatment as well. And so we're working very assiduously with these specific communities, and then from there we can scale up to other areas. We also have a private partnership, public-private partnership, where we have, in terms of chronic disease, where the like Bounty Farm and Sterling will sponsor the child. We have a Sponsor Child initiative where they will buy the strips for the patient, especially if they're type 1 diabetes. They have they're type 1 that's insulin dependent, and so they ensure that they have the drugs and so forth. So we do work with the private partners as well. Surveillance and monitoring and evaluation is very important, because you must know how you're progressing. You may think you're doing well, but then the evidence will show that you're not. So we want to ensure that we have good surveillance system. We're going to monitor and evaluate our programs. And so we are planning to have a STEP survey, which is to detect risks, and it's going to be working. We will be working with PAHO to gather information on behavioral risk factors, anthropometrics, and biochemical status of patients. All right. We have some funding through the Guyanese Diabetic Care Project, and we're hoping to launch a database system at the Ministry of Health to aid with surveillance and monitoring and evaluation of the chronic communicable diseases. In terms of public policy and advocacy and communication, as you know very well, we're having a multi-sectoral approach. We cannot do it alone. We have to have other stakeholders, and so we're hoping very soon. We haven't started it. In fact, it was there before, but we want to resuscitate a non-communicable disease procurement commission. It's really the President's Commission for NCDs, and so we want to resuscitate that very soon. As you know, also, we're hoping to table draft legislation prohibiting the smoking of cigarettes in public places, at healthcare facilities and education facilities. The legislation will more or less protect non-smokers from dangers of secondhand smoke, but it will not criminalize individuals who choose to smoke, responsibly. All right. So the draft tobacco legislation, which we hope to carry to the Parliament very soon, is basically prohibiting the sale of cigarettes to minors, and basically we want to let persons know that we are serious, because we definitely want to prevent tobacco-related diseases. At first, we were thinking whether we should work with the finance minister in upping the taxation of tobacco products from 27%, which is currently, to 50%. And so we've had, persons find out what's happening, people have been calling. But we have left that part to the finance department. We won't touch those. We will just stick to our, our health and our disease prevention and health promotion aspect. In terms of program management, we'll continue to foster efforts with the Ministry of Local Government or communities and regional development. So not only at central level, but also in all the 10 administrative regions, we can improve the quality of care to our patients and citizens of Guyana.
Miss, if I can stop you there. You mentioned the diseases. Mm-hmm. We know that when you took office, just after there was a Zika outbreak.
Yes.
Can you say how would you rate the ministry's performance in terms of the vector control services with dealing with the disease?
That's a good question. Actually, I was moving from non-communicable to communicable disease. And of course, those are communicable disease. It comes under the aegis of communicable diseases. So far, I think we have done very well in terms of vector control. As you know, Zika, we are very close to our neighbors, Brazil and Suriname. So we've had activities to detect basically passive surveillance. We continue to have activities at literature schools, the communities, the mining localities. We've gone through to give insecticides and treated bed nets to miners, loggers, and other villagers. And of course, you'd have seen from time to time we're going fogging certain areas, permanent structures in the mining camp. We have it under control because since our initial case detection of one person from, I think it was Rosal, who subsequently went to Diamond, we've had about, I think, 9 to date. That's what we've had to date. And we have been continuing our monitoring and evaluation of the program, our house-to-house visit, identifying breeding sites of mosquitoes, trying to eliminate the breeding sites, insecticide residual spraying, and as I said before, or fogging to decrease the adult mosquito population.
Okay, Minister, thank you. With regards to suicide, I know that's something that you've been following very closely. Mm-hmm. Can you say, from December to now, we have seen somewhat of a reduction. Can you touch
Thank God for that. Yes. Well, we have been, in fact, we have no choice. We call it plebeian choice because we have a president who seems to be on top of things, and he ensures that the Ministry of Public Health don't left behind. And so since this year would have broken, he summoned myself and the senior minister to a meeting at his office with other ministers from other sectors. And from that time, he outlined, what he would want to see, basically a reduction in suicide, because we are number one in this hemisphere. And so after that meeting, we had an intersectoral meeting at the Marriott Hotel, and then we've had like a task force. We have a suicide prevention plan and a mental health action plan, and so we looked at 4 strategic areas. All right, focus on health promotion, risk reduction. We focus on the reduction of suicides in terms of pesticides involvement. We also focus on strengthening of the health systems, the health centers, screening tools and so forth, and surveillance and research. So having that, we identify task force members to look at each one of those strategic areas. And so we've had several meetings after that. And then we had a stakeholders congress at the Artichong, which you have been privy to, because everybody's doing something and we need to know who is who and what they're doing. And so that was a very successful meeting at the Artichong, where we roll out, we have a database of all our partners, and so we step up our campaigns, and so folks would have gone back to their regions and spread the word. Since that time also, we have established a mental health unit, right, which there wasn't one before. So they've been keeping on going to various areas in terms of the regions to talk more about suicide and to see cases. All right. We have also included you in terms of media. We had a meeting with the media. We had brung back sessions with PAHO, as well as recently we had a meeting, a stakeholders meeting with the media. And there we also, there again I should say, we spoke about responsible reporting, because we definitely don't want to see these graphics in the front page. Sure, there are suicides happening around different worlds, but you don't hear about them in the States or Canada or anywhere else. But as soon as anybody comes to our country, it's in the front page. So we have to work together as a team. As I said before, Ministry of Public Health can't do it alone. So it takes the media and it takes everybody else, other stakeholders, so that we can address the program. And it's going well. I think we are starting on the right foot, and we have seen almost immediately some successes in that area.
Okay, with the 50th anniversary coming up in just a few days, can you say what preparations are in place from the ministry's perspective if there is to be an outbreak of some disease or some sort of casualty?
Okay, the Ministry of Public Health stands ready at all times. We are on call, shall I say, 24/7, especially the first department I spoke about, the regional health services. We have our medical outreaches, and we will be, especially for all the events that will take place, we have our medical team out there. Okay, but at the same time, we are telling persons, because the population or the populace, they have a part to play too.
Do you have anything more to say on that point before we move on?
Well, basically, I can say for Health at 50, we have future projections for our ministry. We would like to see going forward, because we've just had the first 50 years. So it's good to retrospect and look backwards, but we have to look forward. And so we would like to see in the Ministry of Public Health, computerized and interlink database system. We would also want to see evidence-based practices. Guyana is data-rich, but I want to say we might be information poor. And so we definitely want to ensure that whatever we say, it's backed up by evidence. And so we want to work on that. We want to implement effective telemedicine. As you know, Guyana is so vast. We have 10 regions, especially regions 1, 7, 8, and 9. And even though you would have sent medical personnel to those areas, so we want to ensure that they have good communication system, cell phones, and so forth, so we can, in case they would have had any encounter or difficulties, they can, relate with their seniors, so they can have correct diagnosis being made, etc. We want to improve or step up our use of multidisciplinary team approach in medical services. So you don't want to have it ad hoc. You want to work with X-ray technicians, you want to work with environmental health unit, you want to work with all the players in medical, in this sector. So we don't want it to be isolated, but we're working on a team approach with all the different disciplines in the ministry. We also want to promote health literacy, because there's always a saying, we need to improve our patient-doctor relationship. And so I want our patients to be more au fait. They can be able to make informed choices about their health, but they have to be informed first. So I want to impress on our doctors and the healthcare workers to ensure that they speak to the patients, they talk to the doctors, the patients about their medications and their lifestyle changes. So we want to step up our, health literacy and our doctor-to-patient relationship. So another future projections we have is to ensure that we improve the procurement aspect of our ministry in terms of drugs and medical supplies. We want to have a formation of the procurement unit and a national procurement oversight committee to ensure efficiency and the acquisition and delivery of drugs to the various health institutions nationwide. We want to move from sole sourcing to open competitive bidding, so that we can ensure that everyone has a part and be involved in the delivery of drugs to our people in Guyana.
Okay, Minister, thank you so much. My final question. Going forward, should I rephrase the question? In a nutshell, what would you say has been the performance for the ministry? How do you feel about it? And going forward, what kind of Guyanese people expect from you in your second year in office, sorry.
I would say objectively and that we have performed creditably. We have modest successes but sustainable. We have done well as we strive to offer Guyanese the best quality of healthcare we can. It's a work in progress. I wish to ask our supporters that to trust us as we strive to build a world-class health sector. The APNU+AFC government is committed to improving not only the delivery of the best quality care, but accessibility to health care to all Guyanese. We want to achieve universal access to health care, and that's one of our national priorities. So as we move into 2016, we at the Ministry of Public Health will continue to work assiduously to ensure that all Guyanese can benefit from public health care that is the best quality, equitable, and equally accessible.
Okay, Minister, thank you so much for being with us.
Yes, and at this time I want to wish all our citizens a happy 50th Independence Anniversary, and please enjoy the festivities responsibly. I urge you to make healthy choices so that we all can live a better life in our beautiful Guyana.